and thank you for your interest in the Holyoke, Massachusetts site of the NYU Langone Advanced Education in Pediatric Dental Residency Program. I'll be talking to you today about our site, our location in Western Massachusetts, and the program in general. I would like to introduce you to our Associate Program Director, Dr. Rosa Shelton. She is our on-site leadership, working closely with Drs. Akuji and Kane. She received her pediatric dental training at Rutgers University and is a board-certified pediatric dentist. The residency program is located primarily in Holyoke, Massachusetts, and we also work at offices in Chicopee and Springfield, Massachusetts. Holyoke was initially an industrial city, and the energy source came largely from the canal system that still runs through the city today. When the city was built, it was well planned and built on a grid system, which is highly unusual for a New England city. While today the city has a large Puerto Rican population, they originally had one of the largest Irish populations in the country and still host a great St. Patrick's Day celebration each year. For a fun fact, a species of dinosaurs was found right here in Holyoke, Massachusetts. Also, volleyball was invented in Holyoke, and if you drive around the city, you'll find multiple signs just like this one. As I stated, Holyoke is home to a large Puerto Rican community, which has only grown since Hurricane Maria hit Puerto Rico in 2017. It is the largest Puerto Rican community outside of Puerto Rico itself, and it makes up about half of Holyoke's population. Here are some demographics about the city of Holyoke. About a quarter of the population is under age 18, and about 29% of the community lives below the poverty line. This is the group of people that the Holyoke Health Center aims to help and treat. MassHealth is the Massachusetts Medicaid program, and it is very generous with its oral health care benefits, particularly those for children. The majority of our patients are covered under MassHealth, while some do have private insurance. In the residency program, we have certain rotations we have to complete. Most of these, including the anesthesia rotation, where you learn skills like intubation and IV starting, are done at Bay State Medical Center, which is the largest hospital in the area. Our emergency medicine rotation, as well as on-call responsibilities, are also at Bay State. Some other rotations include our pediatric medicine rotation, which is done with the pediatricians at the Holyoke Health Center, and the craniofacial or cleft rotation at Shriners Hospital. Lastly, we do a teaching rotation at Tufts University in Boston, teaching pediatric dentistry to the predoctoral students. In addition to that, we also have externs from Tufts each year. This slide discusses the productivity of the residency program. Typically, we have 8 residents at the site, 4 in each year, and on average, a resident will see about 800 patients per year between their clinic and hospital care patients. Based on the NYU Langone online logging system, these are some examples of the different syndromes and conditions that our patients have and the types of medical conditions you may gain experience in treating. As you can see, there's quite a variety. About 2/3 of our patients treated were Hispanic or Latino. Many of our parents and families only speak Spanish, and if you speak Spanish before coming to the program, that will certainly help you, but if you don't, you can expect to learn a lot of the language while you're here. As I stated before, the vast majority of our patients have Medicaid or MassHealth as their primary insurance. As a health center, we do have other options to help the families of those patients who do not have insurance or may be self-pay in order to make sure the children get the care that they need. Now that you've learned about Holyoke, we'll start to talk about our faculty and our facilities. For our faculty, you've already met Dr. Shelton, our Associate Program Director, and we have her as full-time faculty as well. We also have Dr. Lila Nin, another board-certified pediatric dentist, as full-time faculty, and she did her pediatric training at Tufts University. Dr. Maureen Quinn is with us 1 day a week as another pediatric dentist, and we're fortunate to have Dr. Anna Sereno as our full-time orthodontist with us. We also work closely with our 2 hygienists, Christine and Jen also runs the portable school dental program. Our main site is the Holyoke Health Center. Here we treat most of our patients, do our sedations, and have our pediatric medicine rotation. Connected with the pediatric dental clinic is the ortho clinic, which allows us easy communication and consults with our orthodontist. This is also where residents gather for the weekly video teleconference for NYU Langone. The bottom picture shows a typical operatory, and in the window, if you look closely, you'll see some of our puppets which we use for patient education. Our facility is equipped with all digital radiographs, an isolite in each room, and we have an iTero scanner for digital impressions, which we use in conjunction with the ortho department. In addition to ortho, we also work closely with multiple oral surgeons and have access to consult with an on-site endodontist and periodontist. It is also very easy to consult with the in-house pharmacy, which also has its own residency program, and with the pediatricians, who are very friendly, and you work closely with them, especially after your pediatric medicine rotation. Here's a map of our area. The Holyoke Health Center is marked, and below it, or just south, you'll see Chicopee, where we have our Chicopee Health Center, and Springfield, the location of both Baystate and Shriners hospitals. It only takes about 15 minutes to go from one end to the other, so the locations are fairly close. Here are those other locations that I talked about: Shriners Hospital in Springfield, Chicopee Health Center in Chicopee, and then Baystate Medical Center also in Springfield, just to give you some pinpoints of where those are. And again, it's only about a 15-minute drive from the farthest north to the farthest south. Baystate Medical Center is located in Springfield and is where you will take your emergency call. It is also where you do your emergency and anesthesia rotations in your first year and your inpatient and subspecialty rotations in your second year. We also use their operating rooms to treat our patients with general anesthesia. It's important to note that we only take call for emergencies for pediatric patients, not for adults. And collectively, we are on call 24 hours a day, 365 days a year. Shriners Hospital is where we do most of our general anesthesia cases, and we're there at least once a week. We also do our cleft rotation here. Here are some photos of residents working in the OR. While you work in the OR, the attending is your assistant and is giving you one-on-one instruction and feedback, making it a very rewarding learning experience. The Chicopee Health Center is our newest location, and residents rotate to this clinic as well. It is also all digital with radiographs, and here we work closer with the general dentists and the AEGD residents in the adult dental clinic. Through the school portable program, we have more experience with community dentistry, and we treat children from preschool to high school, right where they are at school, making it easier for parents to make sure that the kids get their dental care. At this point, you might be wondering what life is like out in Western Massachusetts, and there's a lot to do out here. We have Six Flags New England, the MGM Casino in Springfield, the Big E comes once a year, which is the biggest county fair in New England, and we also have the Yankee Candle Village. We also have many wineries and breweries and seasonal fruit picking. So in the summer, we're picking blueberries, and in the fall, we switch to more apples and pumpkin picking. If you like snowboarding or skiing, we're not far from many of the mountains in western Massachusetts and Vermont. If you can't find what you're looking for in western Massachusetts, we're really close to a lot of other places you might enjoy. We're about a half an hour away from Hartford, Connecticut, a little less than 2 hours from Boston, and a little under 4 hours from New York City. Lastly, if you're a sports fan, you will fit right in New England, where we are very proud of all of our teams, and we often have at least one that is doing well. In conclusion, I just want to thank you for your time, and we hope you found this information helpful about the Massachusetts site of the NYU Langone Advanced Education in Pediatric Dental Residency Program.